BBL smell. A side effect doctors warn about. A medical perspective. By Dr. Elizabeth Monroe, MD, board-certified plastic surgeon, 15 years of experience. What is a BBL? And why is it so popular? A. Brazilian butt lift, BBL, is a cosmetic surgery where fat is liposuctioned from other parts of the body, typically the abdomen, thighs, or flank sand injected into the buttocks to enhance size and shape. It has become increasingly popular in the US, especially among younger women and social media influencers. However, along with the aesthetic appeal comes a range of functional and hygienic complications that are often overlooked in mainstream discussions. What is the BBL smell? And why are doctors talking about it? The BBL smell is an unpleasant body odor some patients report after undergoing the procedure. This phenomenon, while not widely studied in medical literature yet, has been noted anecdotally by surgeons, nurses, and patients alike. From a clinical standpoint, here's what we suspect contributes to this issue. Kasatu. Difficult hygiene maintenance. After BBL, the buttocks are larger, rounder, and often project further out, changing the natural anatomical landscape. This makes it harder to reach and clean the anal area properly after using the bathroom. Patients often need to wipe around or under the newly augmented gluteal tissue. This physical difficulty can lead to incomplete cleaning, residual fecal matter, and, over time, odor. Kedua, sweat, and skin fold moisture. The newly increased gluteal mass may also cause more sweating in the intergluteal cleft, the crease between the buttocks, which creates a warm, moist environment ideal for bacterial growth. Combine this with tight clothing and limited air circulation, and you have a breeding ground for odor-causing bacteria. Ketiga, post-op restrictions make it worse. For the first few weeks post-BBL, patients are advised not to sit or lie directly on their buttocks. This means hygiene must be done with extra care often while standing or using assistance. Many patients simply don't do this thoroughly. Medical concerns beyond the smell. The smell is just a symptom of deeper hygiene and anatomical challenges post-surgery. If not addressed, it can lead to skin irritation or rashes, fungal or bacterial infections, embarrassment, and emotional distress. Chronic hygiene problems. And let's not forget that BBL has the highest mortality rate among cosmetic procedures, primarily due to fat embolism risks when fat is injected too deeply. So hygiene is just one layer of a much larger conversation. Tips for patients considering or recovering from a BBL. If you're considering or recovering from a BBL, here are some essential hygiene recommendations from a medical standpoint. Use a handheld bidet. A bidet or portable peri bottle can help clean thoroughly without needing to twist or reach awkwardly. Wet wipes over dry toilet paper. Choose unscented, alcohol-free wipes to reduce irritation and clean more effectively. Air dry or pat dry. Excess moisture promotes odor. Gently pat the area dry after cleaning. Wear breathable clothing. Avoid tight, synthetic fabrics. Opt for cotton underwear and loose garments that allow airflow. Be honest with your surgeon. Don't be embarrassed to ask about hygiene strategies during your post-op consultation. Final thoughts. The real cost of BBL. As a plastic surgeon, I understand the desire for beauty, body confidence, and but it's important to weigh all outcomes, not just aesthetic ones. The BBL smell may seem minor, but it reflects deeper issues in post-op function, patient education, and realistic expectations. Cosmetic surgery should never compromise basic bodily functions or hygiene. Before you commit to any procedure, ask yourself not just, how will I look, but also, how will I live with this change? Everyday BBL. Smell awareness. Let's break the silence. As clinicians, we must do better at educating patients honestly. As a community, we must normalize conversations around these side effects because every body deserves both beauty and dignity.